as far as incontinence goes, there's really two types of incontinence that people should be aware of. There's stress incontinence, which a lot of people get when they laugh, cough, or sneeze, they'll dribble. And that's usually due to an incompetence of the sphincter mechanism of the bladder. And as we age or get more mature, as I like to put it, or if you've had babies or have lost some of the support around the bladder and bladder neck, things start to fall. And so when you laugh, cough, or sneeze, the bladder basically herniates down into the vaginal area and the sphincter mechanism opens up. It doesn't stay closed because most all sphincters in the body are circular muscles and they stay closed. And in fact, there's a reflex mechanism with the bladder that when you cough, that sphincter closes more. And when you lose that ability to guard, as it's called, you leak. And that can often be due to a support mechanism issue, or it can be just due to the sphincter being weak. So that's one type of incontinence. The other type of incontinence is overactive bladder, in which case your sphincter mechanism isn't incompetent, but your bladder, for whatever reason, has become irritable. You have to run to the bathroom all the time. You have urgency, frequency, and urge incontinence. And when that happens, the bladder has become hypersensitive. Bladder fills and it fires off nerve receptors in the bladder, and the bladder contracts, almost like a baby. The inhibition from the brain isn't there, and it just contracts and people can't control themselves. And those people are often worse than the patients who are stress incontinent, because they often unload the entire bladder contents at one sitting. Can be very embarrassing at Walmart.